Okay, let's start with a view of your back from the side. As you know, your spine begins at the base of the skull and runs down your back to your tailbone. And these blocks of bone, called vertebrae, are stacked to give your spine its S shape. They protect your spinal cord and are one reason your back's so strong. Okay, let's take a closer look. Between the vertebrae are discs. The discs are tough, flexible shock absorbers that cushion the vertebrae. Together, they allow your back to move and bend. And most of the motion in your back happens in your lower back. In fact, you actually need movement so your back doesn't become weak or stiff. You also have large, powerful muscles to help keep your back strong and stable. Okay, sometimes imaging tests like X-rays or MRIs can show what's happening inside, but they're not always needed. Why is this? Well, for most people, back pain develops over time. Like everything else in your body, your back ages too. For example, some people develop a little bit of arthritis in their back, but this is common and no reason to be concerned. Also, over time, discs can become less spongy and lose their spring. They may even shrink a little. And a disc in this condition doesn't cushion the spine as well as it used to. Sometimes this is called degenerative disc disease. But it's not so much a disease as the gradual aging of your spine. And another thing that can happen over time is discs can lose their shape. And you may hear this called a disc bulge or a bulging disc, a herniated disc, or a slipped disc. And while these are related, they're not quite the same thing. Here, take a look. This is a view of a disc from above. So this is one of your vertebrae, and here's your spinal cord. Now, the outside of the disc is a ring of tough fiber, and the center is soft and rubbery, kind of like Jell-O. But as the spine ages, a disc can become stiff and weak, and when pressure is put on the disc, it can swell. Then the inside can break open a little, and that softer stuff can poke out or herniate like this and make the disc bulge. Sometimes the bulge doesn't cause any pain directly, but the swollen part of the disc can press on a nerve, and this can cause pain. And in rare cases, the inside can break all the way out, and the disc becomes ruptured. So while this looks scary, most people have bulging discs like this that aren't causing any major problems. That's why it's more useful to focus on what you can do to treat the pain.